Hey, this is Dr. Jen Peña here to talk about all the latest headlines in sexual and reproductive health. Welcome to Doom Scroll.
Jen, I need to talk to
Zoey,
you.
let's do this. What's on your mind?
I need to talk to you. This was not an exciting headline to see. A risky pill to swallow. Contraceptive use linked to 73% increase in depression risk. Ma'am, like we have enough to worry about.
That is a doomsday headline.
But I was like, first of all, can you tell me what that headline even means? That's number one. And then I'm looking at it now. And then also, how reliable is this study?
Oh my gosh, I am really, really happy you brought this up for a myriad of reasons. First of all, yes, the headline was super scary. And when it comes to studies, right, every time somebody tells me, I read a study, we are taught in school and in med school for sure to always look for the primary article, right? Because there's different interpretations when people read these studies. And definitely COVID was like a great example of that, right? When all these studies were coming out and people were interpreting them their own way. So I went and I found the primary paper, and it is specifically combined birth control, so estrogen and progesterone. The study, let's talk a little bit about it. So it was done in Sweden. I think the university was called, let me check here, Uppsala University in Sweden. But essentially, they looked at over 264,557 women from a data bank, and they were assessing essentially for depression through interviews, through looking at the data from their charts. It says here on both inpatient and outpatient records. What they noticed was exactly as you said, that the women who were taking combined oral contraceptives seemed to have a much higher risk, and to your point, of 73% higher of developing depression symptoms during the first 2 years of use. So that's what they saw.
73% is not a small number.
No, that is a big number. And so that's what the headline said, right? And so people got very scared. But none of this research has been really like straightforward. And so this kind of just brought a lot back of these conversations that we've had in the past, with similar studies. One of the cool things about this one, though, is that these women that they followed them from, essentially birth through menopause. So it was a very, very long period of time. And I think that does give it value in terms of, being able to follow patients. One of the things that's really interesting, especially for the younger population, is that they notice, and let me check here, 130% higher incidence in symptoms of depression during the first 2 years in teenagers versus 92% in adults.
Why would that be?
This is something interesting, right? I know. And, that's one of those things that when they did the discussion of the findings, they said, the possible reason for this is because teenagers that are going through puberty have already a lot of hormonal shifts and fluctuations versus adult women who have already gone through those hormonal shifts, are not as predisposed to having as much of that impact that might cause the depressive symptoms. And so I thought that was probably the most important thing, in terms of the findings there. The majority of women do just fine with combined contraception. And again, there's tons of other options, Zoey. Some of the other things that they, listed as limitations is some people don't remember, right? It's called something called recall bias. So if they're interviewing some of these women and asking them like, well, when exactly did you start developing mood symptoms when you were on birth control when you were 15? I mean, if you ask me,
exactly. Like middle school was a rocky time.
Exactly. So, I mean, those are some of the limitations. And by the way, this is typical of all research studies. There's always limitations to the studies. No study is perfect. And so that's why I'm always telling my patients or my friends or anybody who asks, like, don't go by the headline, right? Like, do what we're doing. Like, let's talk about it. Let's talk about the things that these researchers say, maybe we didn't do like the perfect job. Most importantly, people just need to remember, that contraception has been around, combined contraception, for a very long time. It is mostly, for most women, safe. Again, if it's not, or there's other options, there's so many more options now. And at the end of the day, it's important for your family planning and to prevent unwanted pregnancies.
This is why I call you.
I'm glad I was able to be of help. I hope.
Thank you so much. I really appreciate it.
Absolutely. Thank you, Zoey.